Hello everyone, I'm going to present my country, Ecuador, or also known as La República del Ecuador or the Republic of Ecuador. Información general, capital es Quito, el presidente actual es Lenín Moreno, el tipo de gobierno es una república y tiene la misma democracia representativa presidencial como el de los Estados Unidos. La población actual es de alrededor de 17 millones de personas. El sueldo promedio mensual es de alrededor de $450 mensuales. Las tasas de mortalidad son maternal 59 muertes por cada 100.000 nacimientos vivos, infantil 11.7 muertes por cada 1.000 nacimientos vivos. Mi esperanza de vida son 55 años por hombres y 80 años para mujeres. Algunas de las mayores causas de muerte en el Ecuador son razones cardiovasculares, renales, cerebrales o incluso por causas externas como lesiones viales, violencia interpersonal y algunos también son debidos a causas congénitas como los trastornos neonatales. Algunas de las enfermedades comunes en el Ecuador pueden ser enfermedades que son transmitidas por insectos, como el dengue, la malaria, la chikungunya, la zika, y también otras enfermedades transmitibles como la leprosis y la tuberculosis. Otras enfermedades comunes que no son transmitibles pueden ser la diabetes, la hipertensión y los neoplasmas malignos. Algunas de las condiciones ambientales del Ecuador es que hay bastantes desastres naturales comunes en donde hay terremotos, actividad volcánica, tsunamis, desplazamiento de tierra, inundaciones por diluvio y incendios forestales, en donde también el 75% de la población tiene acceso a agua potable de forma segura y 42% de la población tiene acceso a saneamiento de forma segura. Coronavirus es una de las preocupaciones actuales de la salud en Ecuador, donde hay 3.646 casos confirmados y hay 180 muertos y solo 100 se han recuperado. Desde el 12 de marzo hubo un toque de queda obligatorio para todo ecuatoriano por 60 días, aunque quizás sea prolongado. Todo tipo de clase, evento masivo de más de 100 personas y actividades religiosas como ir a la misa o atender varas y discotecas han sido suspendidas. Y cualquier viajero o turista entrando al país deben estar en régimen de aislamiento domiciliario obligatorio por siquiera 14 días. Otros mayores factores de riesgos, aparte del coronavirus en Ecuador, pueden ser como los altos índices de masa corporal, la glucosa alta, la presión alta o el uso de alcohol. Algunos datos curiosos del Ecuador es que la amoxicilina es una medicina de venta libre donde no necesita una prescripción médica. Puedes comprar pastillas individualmente sin necesidad de comprar toda la caja. Y en Ecuador es considerada mala costumbre vaciarte con un papel adentro. Y usualmente se bota en un basurero aparte. El sistema de cuidado de salud ecuatoriana tiene un enfoque en la prevención y basada en la atención primaria. Algunas de sus prioridades son la educación sobre la salud con programas interdisciplinarios de alto riesgo y pobreza. Abordan cuestiones como el embarazo en la adolescencia y el uso de tabaco. Los tres sectores del sistema de cuidado de salud ecuatoriana son el sistema público, que es gratis, el sistema de seguridad social, que está dispuesto a cualquier trabajador, y el sistema privado, que es usualmente usado para la clase media alta del Ecuador. El sistema público comprende algunos ministerios, los servicios de la salud de las municipalidades y las instituciones de seguridad social, donde cada ciudadano es asignado una clínica de salud primaria basada en su lugar de residencia, en donde son tratados sin ningún costo o sin ninguna cita, y pueden ser por planificación de acceso abierto o por orden de llegada. Algunas de las iniciativas de la salud pública también abordan factores ambientales que afectan la salud, como el mejoramiento de la infraestructura. El sistema privado también comprende entidades con fines de lucro y organizaciones no lucrativas de la sociedad civil y servicio social. Generalmente estos sistemas privados están ubicados en las principales sociedades en las que la población suele hacer pagos directos de bolsillo en el momento de recibir la atención. The public and private system disparities between the is that Ecuador has around 3,847 medical attention establishments, where 80% belong to the public system and the other 20% belongs to the private system. Although only 14% to 20% of the private system establishments are institutions who profit from providing medical services. Doctors normally tend to concentrate in heavily populated cities, which can generate serious problems of distribution. Um, so basically, there are more health professionals in a specific geographic location in Ecuador than in another. Um, and there is also more purchase of medicine in a private healthcare system than in the public system. Health professionals and reforms. Um, there are about 20.35 available positions per 10,000 population, although there is a low availability of specialist physicians and dentists. In urban communities, there is about 29.01 health professionals per 100,000 population, and in rural communities, there are about 5.42 health professionals per 100,000 population. And about 71.5% of Ecuadorian health professionals work in the public centers. Some of the reforms have been national health policies, policies of free maternity, policies about catastrophic disease coverage programs. But the last one they did was a national plan of good living, in which it talks about the eradication of poverty and promotion of sustainable development and just distribution of resources and wealth, and the total access to healthcare services of high quality without any direct cost towards the patient. I think due to this, there is no need for any new reforms, since it will take decades to be completely implemented, and most of these reforms are consistent with the Sustainable Development Goals of the United Nations. Some challenges that the health system in Ecuador still approaches is that to still give coverage to every 1 in 4 Ecuadorians, try to integrate all the institutions under a single true national healthcare system, reaching continuous progressing at controlling transmittable and non-transmittable diseases, and trying to improve the healthcare in rural communities. Some opportunities, though, is that their intention is to create the solidification of a universal healthcare system for every Ecuadorian. And some innovations that they do is most of the government entities finance health-related research. For example, the creation of another institute between two government institutions that specialize out in care and research and innovations in technology and science and healthcare. The healthcare for a tourist or immigrant in Ecuador, according to U.S. Embassy, should be aware of, since medical emergency aid is limited and specialized medical care costs tens of thousands of dollars. Although this is technically not true, since Ecuador is a hot place for medical tourism, where a lot of veterans or retirees or ex-military retire in Ecuador. You can easily get medically treated in Ecuador with a valid passport and a T3 card, which gives you a tourist visa, and you can ask that at the airport. Many big cities are hotspots for medical tourism, since the cost of getting the right medical treatment is extremely cheap in Ecuador without sacrificing any quality. And the cost of medication per capita is about $18 annually. U.S. versus Ecuador. Ecuador spends about 7.3% of its gross domestic product on healthcare, and is ranked as the 20th country with the highest healthcare efficiency out of 221 countries, whereas the U.S. spends 17.9, but is ranked 50th. Since the U.S. charges higher prices for medical services, uses technology inefficiently, and has a high rank of using expensive pharmaceuticals. The U.S. has a specially driven and fee-for-service model of healthcare, whereas Ecuador has a low-cost, no-cost primary care model that costs less and is more highly correlated to better health outcomes. Although the U.S. has a slightly higher life expectancy and overall better health, Ecuador's responsiveness and fair financing are significantly lower, which leads to a decrease in certain risk factors causing death and mortality rates overall. Unlike in Ecuador, 62% of the U.S. bankruptcies originate from a medical case, and they keep increasing. And unlike the U.S., Ecuadorians don't have to worry about medical debt because there's no cost going directly to them for their health care. Some of the conclusions I gave was that Ecuador is still a developing country, but it's still able to not spend a lot on improving their healthcare system, but have a higher healthcare efficiency than the first world countries like U.S. The cost of the price of medical treatment in Ecuador has nothing to do with the quality of the treatment, whereas price in the U.S. is a key factor in differentiating good healthcare from bad healthcare. Ecuadorian healthcare relies heavily on other social external factors such as poverty, infrastructure, and other sustainable development. The geographical diversity of the country does affect the equal distribution and disposition of healthcare professionals and healthcare facilities. Although there are public and private sectors of healthcare, a majority of these institutions offer free and high quality healthcare. And these are my references. Thank you for your time.